welcome to this new edition of Wellness Watch, a show that explores the nuances of diseases that affect mankind irrespective of borders or language barriers. Breast cancer never knocks, it barges in. It does not even come with any symptoms, but it always comes with consequences. It is one of the most common cancers affecting people worldwide. While often associated with women, it also affects men, making awareness and education vital for all. What makes it dangerous is not just the disease itself, but how easily it can go unnoticed. Today in Wellness Watch, we discuss breast cancer and its management. I'm Preeti Kaur. August 18th marks World Breast Cancer Research Day, a global effort to celebrate the science and dedication behind the fight against breast cancer. With 1 in 8 women facing a diagnosis in their lifetime, this day underscores the power of research to save lives. Here's a detailed report.
World Breast Cancer Research Day, observed every August 18, highlights the ongoing battle against breast cancer, a disease impacting millions worldwide. Launched in 2021, the day plays a multifaceted role in raising awareness by shedding light on the advancements in research, promoting early detection and treatment, reducing stigma, and inspiring advocacy. A disease in which abnormal breast cells grow out of control and form tumors. Breast cancer begins inside the milk ducts. The cancer cells then spread into the nearby tissues, resulting in formation of lumps. If left unchecked, the tumors can spread throughout the body, causing death. With over 2.3 million women diagnosed with breast cancer in 2022, it resulted in 670,000 deaths globally in the same year. Also, breast cancer was the most common cancer in women in 157 countries out of 185 in 2022. In India, breast cancer accounted for 28.2% of all female cancers, with an estimated 216,108 cases in 2022. Though breast cancer can occur in a woman at any age after puberty, but the chances increase later in life. Affecting mostly women, 99% breast cancer occurs in women and only 0.5 to 1% in men. Many factors contribute to the increase of risk of breast cancer. These include increase in age, excess consumption of alcohol, tobacco use, family history, radiation exposure history, and postmenopausal hormone therapy. Early detection and treatment of the disease majorly helps in reducing mortality. For early detection, it is best to know the symptoms that can help you discover the disease at a stage that is curable. The most common first detectable site of spread is to the lymph nodes. People with an abnormal lump should seek medical care even if it does not hurt. On observation, one can see a change in size, shape, or appearance of the breast. There is often a dimpling, redness, pitting, or other changes in the skin around. Additionally, one of the early symptoms include an abnormal or blood fluid from the breast. In many cases, if not treated on time, the cancer may spread to other areas of the body, causing new symptoms such as bone pain or headaches. The treatment of this type of cancer mainly depends on the subtype and how much it has spread. It is also more effective when started early and the full course of treatment is completed. Early access to the cause of disease helps patients maintain or restore their functioning. It is hence advised to see a doctor if any of the early signs are noticed in the body. Patients thus benefit in better treatment, understanding, and improved quality of life. Depending upon the diagnosis, doctors undermine the different combination of treatment that can be useful to minimize the recurrence of the cancer. These include a surgery to remove the cancerous tissue or the whole breast if required. Radiation therapy treats residual microscopic cancers left behind in the tissue, reducing the risk of cancer in the coming back. Selective medicines are prescribed to treat breast cancers that kill the impacted cells and prevent its spread further. Not just in India, countries around the world are working together to address this disease that is expected to increase by 38% by 2050. The annual deaths by breast cancer are projected to rise by 68%. Countries that have succeeded in reducing breast cancer mortality have been able to achieve an reduction of 2 to 4% per year. Strategies include establishment of primary care facilities to secondary hospitals to dedicated cancer centers. This day is a powerful reminder of the impact of research and community action in this particular field. These efforts are crucial in fostering a world where breast cancer can be detected and treated effectively. ultimately improving survival rates and quality of life for millions of women worldwide. Bureau Report, DT India.
Female gender is the strongest breast cancer risk factor. Approximately 99% of breast cancers occur in women and only 0.5 to 1% of the breast cancer occurs in men. It remains the most frequently diagnosed cancer among women in India, accounting for 28.2% of all female cancers with an estimated 2,16,108 cases in 2022. Factors that increase the risk of breast cancer include age, obesity, alcohol, family history of breast cancer, and treatment for this depends on the subtype of cancer and how much it has spread. Doctors generally combine treatments to minimize the chances of the cancer coming back. Today in Wellness Watch, we look for these answers. What is breast cancer? What causes breast cancer? How is the stage of breast cancer determined? Is breast cancer preventable? And what are the medical advancements in India? Breast cancer treatment in India includes a range of options like surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy, often tailored to the individual's specific cancer stage and type. The Government of India also runs a flagship program, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke. This program is focused on controlling non-communicable diseases and three of the most common types of cancers, that is oral cancer, breast cancer and cervical cancer, are an integral part of this program. Up on your screens, we will have the hospitals which specially cater to breast cancer patients. All India Institute of Medical Sciences, Delhi, Tata Memorial Hospital, Mumbai, Sir Gangaram Hospital, Delhi, and Postgraduate Institute of Medical Education and Research, PGIMER, Chandigarh. All right, to help us understand breast cancer better and its management, we're joined in by guests. We're joined in by Dr. Asuri Krishna, Department of Surgery, AIIMS, New Delhi. And we're also joined in by Dr. Ajay Gogia, Professor, Department of Medical Oncology, AIIMS, New Delhi. Thank you both of you for joining us this afternoon on Wellness Watch. Dr. Gogia, to begin with, I would want you to explain to our viewers in very simple terms what is breast cancer. Though we did show a detailed report, but for a person to get acquainted with this, I would want you to explain in very simple terms what is breast cancer.
So breast cancer is nothing, it's just a abnormal proliferation of breast tissue, and this breast tissue can be ducts or lobules. The ducts is which carry the milk products, and the lobules is where the milk is produced. So it can be occur in lobules, and ducts is mostly in the ducts, is 90% in the ductal tissue is called invasive ductal carcinoma, and rest 10% is invasive lobular cancer which occur in the lobules. So it's the abnormal proliferation of all the breast tissue of the major concern related to lactation is majorly is breast cancer.
All right, Dr. Krishna, I'll take that forward to you. What are the early symptoms that one should look for, when we talk of breast cancer?
So any female above the age of 30-35, if she feels a lump in the breast, it is of concern and should always be examined by a surgeon. And if there is any abnormal discharge from the nipple, so abnormal discharge from the nipple, especially a bloody discharge, and feeling of a lump, should always suggest that there is a possibility that the patient might be having breast cancer and needs an evaluation by a professional, invariably a surgeon. Yes.
All right, Dr. Gogia, are all lumps cancerous? One. And secondly, when we talk of pain in the, in the area of the breast, should that be an alarm bell for the patient?
So usually breast cancer is present with the painless lump. We have done our the database collection, and we found that 90% of the breast lump is painless in breast cancer. And mostly if the pain in the breast with the lump, the most common diagnosis is benign breast disease, which usually occur in between the 20 to 40 years of age. So mostly breast lump in the breast cancer is painless, mostly means 90%. And in case if the breast lump is present with the very pain, is there other differential diagnosis in the age group of 20 to 40 years is like benign breast disease, mastitis, fibroadenosis, like this is more common than breast cancer.
All right. Dr. Asuri, I would want you to explain to our viewers, how is the stage of breast cancer determined?
Okay, so in staging of the breast cancer, basically we have something called we need to know the tumor size, we need to know the nodal status, and we need to know whether the tumor has spread somewhere other than the breast or not. So that completes your entire staging. So tumor size is usually assessed by examination and by doing a mammography, which will tell you the size. The lymph node status can be assessed either by clinical examination or by doing an ultrasound of the axilla. And the spread to any other organ other than the breast is usually assessed by doing a whole body PET scan, what we call the PET scan, the PET scan. It can either be supplemented by a CT chest or CT abdomen, depending upon where exactly the tumor has spread. So these are the investigations which are required to completely stage a patient with breast cancer.
All right, that were the clinical, methods. How reliable are self-breast examinations that are done to, to gauge is a patient suffering from cancer or not?
Definitely, ultimately, if you want to screen the patient, is mammography is the best method. Mammography is just not the X-ray of the breast, but where the mammography facility is not available, where the clinician is not available, the second best is clinical breast examination, and third best is self-breast examination if there is no mammography machine or no clinician is available in a rural area. So self-breast examination is definitely helpful to detect early, but it is not very sensitive like mammography.
All right, we've talked of the stages. When is it that a cancer is detected in a patient? In the later stage, or do we also have patients where breast cancer is detected early?
So in India, the most common presentation is usually stage 3 and stage 4. Around 70% of the patient present with the stage 3 and stage 4. But in the Western world, this data is different, usually 70 to 80% in the early stage.
Why is it that so?
So because of their screening program is very extensive, and their screening program started at the age of 40 years. Annual screening mammogram detect around 41% of the breast cancer in early stage. So that's why in Western population, the usually patient present in the early stage, stage 1 and 2, because of the extensive mammography screening program.
All right, Dr. Asuri, sir talked of the stages and also how it is detected. But then for a person to go to a doctor, what are the early symptoms that, that point to breast cancer? And when is the time to see a doctor? Because generally the lump is painless, and, in our busy lives, we do not pay much heed, we do not pay much attention to something that is not causing us pain. What is your take on that? And when is it that a person should see a doctor?
As Dr. Gogia also pointed out, majority of the patients that we see in India are either in the stage 3 or stage 4. And the main reason for this is because any lump in the breast, most of women in our country, they tend to ignore it.
Yes.
Until it becomes painful. Pain in a breast cancer patient is a late sign. It occurs, that means that the tumor has advanced quite a lot and now it has become painful. So if any woman has a painless lump, whatever size it is, whether it's a small, medium or large size, it should be consulted, should be shown to a doctor, required mammography and required what we call a biopsy has to be done. So any breast lump in a patient who is more than 30 years of age needs to be evaluated to rule out any breast cancer.
All right, Dr. Gogia, what are the risk factors when you talk of breast cancer?
So majority, you already told this, age is the most common risk factor. Second is sex is the most common risk factor. It's already in female, and 99% of the breast cancer in female. So age and sex is the most common risk factor and the most strongest association with the breast cancer. And other risk is definitely, yes, in recent year, alcohol consumption is a majority of risk factor. Chronic estrogen exposure like early menarche, late menopause, late marriage, late breastfeeding is the other hormone driven the breast cancer. And the fourth most common is heritable breast cancer, which is usually turned to around 10 to 15% of the all breast cancer is from genetic, is related with the genetic mutation or any heritable penetrance gene.
Is genetic breast cancer common? Is it always that if a mother has a cancer that will, follow up with the daughter, and perhaps the rest of the clan as well?
Yes, I said
The
it
females?
around is 10 to 15% of the all breast cancer is heritable, and depending on the what type of breast cancer his mother has, suppose if the relative has triple negative breast cancer, then this percentage turned to be 20 to 25%. Because triple negative breast cancer is one of the breast cancer gene BRCA1 gene is associated with triple negative breast cancer, and this frequency is 25% in triple negative breast cancer. Overall, in normal population, it is 10 to 15% of breast cancer is heritable or genetic associated.
I would want you to also explain to our viewers what are the types of breast cancer, what are the kinds of breast cancer, and which type is the most severe?
So the breast cancer's majority is in three types. Like one is hormone positive breast cancer, like is ER or estrogen receptor positive, progesterone receptor positive is one type of breast cancer, which is around 60% of the cases in India. Second is triple negative breast cancer, which is ER negative, PR negative, and HER2 negative. It is the second most common cancer in India, which is present in 30% of the cases. And the third one is HER2 positive breast cancer, irrespective of hormone profile, which is present in 10 to 15% of the cases. So these three majority of type of cancer in India, like is hormone positive 60%, triple negative 30%, 10 to 15% is HER2 positive. And among all, irrespective of stage, the triple negative breast cancer is the major concern which cause the early relapses and mortality. And in India, it is majority of breast cancer, like 30% in India, and compared to West is 15%. So triple negative breast cancer is the major concern in India because of the early relapse and the mortality.
All right, Dr. Krishna, do environment toxin exposure and radiation also lead to breast cancer?
Yes, there's definitely some role that has been proven that radiation exposure especially can predispose to development of breast cancer, and we are nowadays surrounded by so many pollutants, and it is very hard to say whether pollution will affect developing breast cancer. And yes, it is definitely one of the contributing factors. It might not be a big percentage, but yes, definitely you can see the number of breast cancer cases that have increased over the last decades. It only shows that apart from genetics, environmental factors are one of the key factors contributing to this increase in number of breast cancers worldwide.
All right, Dr. Gogia, what is the difference between radiation therapy and chemotherapy? And can cancer also be treated by treating the lymph nodes?
So radiation therapy is basically control the local tumor bed control. It's a local control rather than systemic control. Chemotherapy, target therapy, and immunotherapy is a kind of treatment, medical management, control the systemic control, means it control the blood rather than the tumor bed. So radiation is a modality which control the local, and chemotherapy is a part that control the systemic and local also.
All right, Dr. Asuri, what follow-up care is needed once a patient has been treated for cancer, and what are the chances of breast cancer coming back, recurrence of the cancer?
Okay, so the most important thing that a breast cancer patient has to remember that breast cancer is a disease which has to be closely followed up. So once your treatment is complete, which may take anywhere between 3 to 6 months, once that is complete, you have to be on a good follow-up. So usually we say follow-up every 6 months, initial 2 years, and then maybe annual follow-up thereafter. Mammography needs to continue to be done, and patient, if develops any symptoms or signs suggestive that the tumor has spread to somewhere else, then that particular part of the body needs to be met, maybe a CT scan or a whole body PET scan need to be done. So follow-up of these patients is very, very essential. Recurrence. Now, if as Dr. Gogia already pointed out, we have 3 different types of breast cancers if we talk about, and the recurrence rate is different. Usually the hormone receptor positive breast cancer, they tend to do well, and the recurrence rates are much lesser compared to that of a triple negative breast cancer. So triple negative breast cancer, the recurrence rate may be as high as even 30 to 40% over a period of time, and therefore the recurrence rate depends upon the type of breast cancer that we are dealing with.
All right, Dr. Gogia, acquaint us with what medical advancements have been made in India with regard to breast cancer.
So medical advancement in last 1 decade is in all the 3 fields, like in surgery, in the radiation, and in the medical oncology side. So my first concern is medical oncology side, because I'm the medical oncologist. So first is the target therapy is the well known fact that target therapy is the major game changer in the breast cancer, like in the trastuzumab and pertuzumab, which will lead to over 8 to 10% survival benefit in the breast cancer in HER2 positive disease. So this is available freely available in India. So these two medicines are mainly game changer. Second is immunotherapy in the triple negative breast cancer is upcoming role in the medical management of triple negative breast cancer. And in the hormone positive breast cancer, there is a different CDK4/6 inhibitor which lead to so many changes in the management of hormone positive breast cancer in adjuvant and metastatic setting. So these are immunotherapy, target therapy, and hormone agent. Recent hormone treatment has changed the management of breast cancer in the last 1 decade, and the survival improved like 8 to 10%, like if we compare with the 1 decade earlier.
Does cancer always strike after the age of 40? Is it ever witnessed in early motherhood, or for that matter, is it safe for a woman with breast cancer to feed a child?
Yes, if the patient diagnosed with the breast cancer, because we have so much modality, like recently if the pregnancy associated breast cancer, or if the patient has pregnant during the diagnosis, we tend to early start with the chemotherapy. So during chemotherapy, the breastfeeding has to be stopped.
All right. So those were our questions and answers by our specialists on breast cancer. They help us understand it better. But for more clarity, we'll have a quick rapid fire round where I'll ask you questions and you can give us crisp answers for some myths to be busted for our viewers. Dr. Asuri, a breast injury can cause breast cancer, is it?
No.
Antiperspirants and deodorants cause breast cancer, Dr. Gogia?
It's not if you contact directly. It makes some studies showed it cause, but if you is indirect contact with the deodorants, it's definitely not.
Breast cancer always causes a lump you can feel, Dr. Krishna?
Always causes lump?
May or may not feel, yes.
Okay. Birth control pills increase the risk of developing breast cancer, Dr. Gogia?
Recently, all the data showed it is not.
Needle biopsies cause cancer to spread, Dr. Krishna?
It is a complete myth, it does not.
And risk of breast cancer cannot be minimized, Dr. Gogia?
This can be minimized when you adopted the simple lifestyle, active lifestyle. Definitely yes. Avoid smoking and alcohol.
All right, so lifestyle changes are the crux here. Thank you so much, both of you, for joining us this afternoon on Wellness Watch and helping us understand breast cancer and its management better. So after this wholesome discussion, we did understand that breast cancer is more than a diagnosis. It is a challenge faced by millions and a stark reminder that health is never guaranteed, but always worth fighting for. Early detection, regular screening and ongoing research are not just tools, they are lifelines. Every self-exam, every mammogram and every shared story matters. On that note, we'll end this discussion here. Thanks for watching Wellness Watch. Bye-bye.